back to the diabetes and different types of that, and then use this knowledge that now we have from the blood sugar, insulin, ketones, and ketosis. Okay, let's talk about different types of the diabetes and the interventions that the physician might advise you to do. So, first of all, diabetes type 1. Diabetes type 1 is usually a genetic problem that you have, and it means that your body, your beta cells in the pancreas, they cannot produce enough insulin or any insulin at all. And that's a dangerous situation because you need insulin to, first of all, to tell different cells to use the blood sugar, to use the sugar to for energy, and then you need insulin to do many more things in the body. So when you don't have it, you're in a trouble. And what's the intervention? They would give you an insulin pen that, or a pill, or things like that, that you can consume like once a day or every few hours and stuff like that. So there are different types of insulin, like rapid acting or long acting, that they can, for example, long acting is the one that you uh, inject once, or take in once a day, and it just slowly releases and it slowly um, affects the body during the day. So that's the intervention, giving you some more insulin for the situation that you don't have enough insulin because your body cannot produce the natural level of the insulin that your body requires to handle all of these processes. Okay, that's diabetes type 1. What's diabetes type 2? Diabetes type 2 is when your blood sugar is so high because you've consumed high carb meals for so long, and the blood sugar stays high for a long time, and then you get the impacts of that we just discussed before. So what's the intervention to that? They usually give you pills, like metformin, or different things like that, that they help you to lower down the blood sugar. There are different mechanisms to do that. So those drugs and medicines, they do different things. Like some of them help the body cells to listen more to insulin. So they uh, try to fix the insulin resistance. Some of them uh, lower the blood sugar by inhibiting some hormones that produce energy and stuff like that. Some of them get you to eat less. They prevent that hunger signal and stuff like that. So those are the interventions. But a very bad situation is when you get insulin resistant in type 2 diabetes, and then they give you more insulin to fix that. So as we explained in the previous slide, when you have high blood sugar for so long, you will have high blood insulin for so long, and then your different tissues get insulin resistant. Okay, so they try to protect themselves. That means that they're not listening to the normal tone of insulin in the bloodstream. So you need to shout higher and higher. And you reach at a level that your pancreas cannot produce enough insulin. So that message is not loud enough for the cells to listen. Okay? So what do? In this situation? Sometimes they give you more insulin to inject. And uh, I don't know what to say. That's ridiculous. Because the whole problem is caused by high insulin. Why on earth would you give someone that is having situation of high insulin more insulin to fix the problem? It fixes the problem. It lowers the blood sugar, but it doesn't fix you know the main problem, the root cause. It's actually worsening it. Okay, so that's type 2 diabetes. So, uh, what's the relation of these two? These are, as I just explained, these are different diseases. These are different conditions. One is not having enough insulin. The other one is having high blood sugar, having insulin resistance. So your body doesn't listen to the insulin. So the only reason that these are related and they're using the same name is the symptom is high blood sugar. So they're different, totally different diseases. The intervention is different and they're not related that much. The only relation is that symptom. The symptom is high blood sugar. So that's why they're calling it type 1 and type 2. There is another uh, type as well, type 1.5 or LADA. So LADA means it's a abbreviation for latent autoimmune diabetes in adults. So what does that mean? So sometimes you get this autoimmune issue, sometimes because you had diabetes type 2 for a long time, that your pancreas cells get damaged, or sometimes you get this autoimmune issue because you're consuming things that are causing that autoimmune issue. I'll have another video on that, on the autoimmune, the whole autoimmune diseases and stuff like that. But you have that's the situation that uh, you're not born with the type 1 diabetes, but you're getting diabetes later. Okay, as an adult, you're getting that. So your pancreas getting damaged by your own immune cells or by the effects of the high sugar, high blood sugar, and stuff like that, and then you get type 1 diabetes. So they call it 1.5. So it's both of type 1 and type 2. That's another type as well. And then there is this concept of pre-diabetes. I want to talk about this because it's very important. So I hope that by now you have a good understanding of different levels of the blood sugar and the role of insulin in managing that and insulin resistance and stuff like that. So it's it's very interesting that they tell you that you have pre-diabetes as if you're getting diabetes. So I explained the whole situation of diabetes and stuff like that. Pre-diabetes, I think it's a wrong term. You cannot be, let me give you an example. You cannot be a little bit pregnant. You either are pregnant or not. You cannot be a little bit, infected by virus. You're either infected by virus or not. Okay. So pre-diabetes means that you have diabetes, that you've done something in your lifestyle, or your body has some genetic predispositions that you have diabetes. Okay. Pre-diabetes means that the symptoms are not as high as they say that you have full diabetes. So it's not a correct term, I think. That's my opinion. Well, so when your doctor tells you that you have pre-diabetes, translate that, interpret that to I have diabetes. What can I do? It's a dangerous situation. I should do something right now. Okay. And then um, how do they how do they diagnose these conditions? As I explained before, they diagnose it by blood glucose test and then HbA1c in recent years and stuff like that, which doesn't give you a proper and accurate picture of your health. Okay. Why is that? So let's say that you're having a high carb diet for a lot of years, and then your blood sugar stays the same. How does the body manages that high blood sugar? By now we know that body produces more insulin and tries to keep the blood sugar at a good level. Okay. So every time that you get that blood test, your blood glucose is at a perfect level. It might go a couple of points higher or lower and stuff like that, and it's all good. Okay. So your doctor is happy, you're happy, you don't feel anything. But underneath that, your body is just screaming um, for help. It's just producing more insulin, more and more and more. And gradually, every part in your body might get insulin resistant. And you're getting all of those damages in your body. But it takes years because your body is regulating blood sugar so tightly because it's so corrosive, so damaging to the body that it doesn't let the blood sugar stay high for a long time. And it manages the blood sugar very well, very tightly. And it does that for a lot of years until it reaches a point that it cannot do that anymore. Okay? So it fails to manage that. And that's when you get diagnosed with diabetes. So if you look at it correctly, if you can diagnose this condition at the very beginning, when the insulin starts to go high and you're starting to get these symptoms, then you will know it soon enough to be able to reverse it, to be able to stop this progression of the disease and condition. Okay. I hope that you by now you're guessing what's the best way of diagnosing these conditions. And if you're guessing that's getting a insulin level blood test, like fasting insulin, you're right. So if you can measure your fasting blood insulin, because the insulin level should be at a certain level in the body, and it shouldn't go high and low when you're fasted. And if it's higher, it means that you have some level of resistance in some part of the body that it's not listening to the insulin. And your body is just responding with producing more insulin. Okay. So you're catching insulin resistance early enough if you see high blood insulin in the blood test. Okay. So that's the best way of catching this disease early on. And anytime that your doctor is ordering some blood tests for you and it's just blood glucose, just getting the fasting blood glucose, that's not enough. Just talk to your doctor and ask him or her to order you uh, blood glucose, HbA1c, and then fasting insulin as well. Okay, so all of these together can give you a picture of how healthy you are. Okay, and if he's not ordering anything related to diabetes and blood sugar and stuff, the only thing that he or she can do to make sure that you're healthy enough is fasting insulin. So fasting insulin is much more important comparing to the rest of the blood test uh, in this discussion that you can do. So that's the first thing that you should do. Okay, so every time, but they don't order it normally, so they find it very hard. I don't know why that is. Maybe insurance doesn't pay for that, or I don't know why that is. But that they don't usually do that. So try to convince them. Try to take this discussion to them and convince them to order that test for you. That's the only way that you can catch the uh, disease early on. So you have time to do something about it. Okay. But you might be interested in knowing that if you are insulin resistant or not. So there is another way of doing that. There is another test that they can do. It's called HOMIR, so homeostasis model assessment of insulin resistance. And it's not a test, so it's not like insulin test or blood glucose test. It's a calculation. Okay, so they multiply fasting glucose by fasting insulin and then divide it by 405. And if the result is close to 1, it means that your body is very responsive to insulin. So it's not resistant and it's good. And as it goes higher and higher, like above 2 and stuff like that, your body is insulin resistant. So there is some level of insulin resistance in some part of the body. So together, fasting insulin and then home IR can give you a good picture of your metabolic health, how healthy your body is in relation to managing the blood sugar and stopping all of those damages of blood sugar, high blood sugar, and high blood insulin.